During Parkinson's Disease Awareness Month, a look at how deep brain stimulation therapy is offering relief to so many. Dr. Juhi Shahed is here along with Jeff, who is a Parkinson's patient. Thank you so much for being with us.
Great.
Hi.
Dr. Shahed, I want to start with you. Tell us a little bit more just about Parkinson's disease in general.
Yeah, so Parkinson's disease is a brain condition. It's a neurologic disorder that unfortunately has a tendency to kind of progress over time. And the main symptoms that it causes for patients are related to movement. And so people might experience things like tremor, stiffness, slowness of movements, and difficulty with walking and balance. And the challenge is that this can really start affecting their ability to just do day-to-day activities. So things like walking around the house or getting dressed in the morning, even sitting down to and enjoy a meal. These are all things that can become increasingly difficult for patients over time. So Jeff and I are happy to be here joining forces with Medtronic to raise awareness about this condition and also to talk a little bit about some of the treatments that are available. And that's really the good news, because although there isn't any cure yet for Parkinson's disease, we do have a number of different treatments available. Those can include different medicines as well as some surgical treatment options that can help control those symptoms and improve quality of life for patients living with this disease.
And can you explain deep brain stimulation?
Yeah, so deep brain stimulation, or DBS, is one of the surgical treatments for Parkinson's disease. And we really usually recommend this for our patients after they have been taking medications for a period of time, but the medicines are no longer giving them the degree of symptom control that they need in order to get through their day. And the way that it works is like a pacemaker. So we have a battery that's implanted into the chest. The battery is connected to brain electrodes that are implanted into the deep brain structures that control movement. And when we program the device, it delivers a small electrical current into those deep brain structures, and it can really kind of override or block the messages that are producing those symptoms that we talked about, like tremor and stiffness and slowness. And it's really amazing to see how quickly we can see symptoms responding to this electrical therapy. And Jeff was really no exception there. It's a treatment that we really kind of feel very strongly about, but we also want to make sure that people understand that it's not for everybody. And so if you are interested in this treatment, we urge people to find out more information, talk to their doctor, understand the risks and benefits, and see if they're a candidate.
Jeff, what are some of the biggest challenges that you face living with Parkinson's?
Well, I was a dentist for about 40 years, and because of the tremors, I had to retire. I became, the tremors started to cause problems with everything in my life. I couldn't make coffee in the morning for my wife. Everything just started to go downhill. And then I decided to take things into my own hands, went into research, found out about DBS, and then found Dr. Shahed.
And how has deep brain stimulation helped you?
Oh, it's been great. It's just, I have no tremors, no shaking, nothing left. And as you can see, my hand is as straight as can be. I can play with my kids. I can play golf now. It's just great. And I want to thank everybody. And being from Baltimore, I want to say go O's and go Ravens.
Absolutely. And we are so happy that you are doing so well. Where can we go for more information?
Yeah, there's a great website, discoverdbs.com. You can find out information there about deep brain stimulation, but also get connected with a movement disorder specialist who has experience using this treatment to treat Parkinson's patients.
All right, I want to thank you both for being with us. Really appreciate it. And we'll be right back right after this. Stay tuned.